Hi, welcome to our telehealth video information series. I'm Garvin, and this video is on Doxepin. So what is Doxepin used for? Doxepin is a tricyclic antidepressant that affects chemicals in the brain that may be unbalanced. Doxepin, or the chemical ingredient Sinequan, is used to treat symptoms of depression and or anxiety associated with alcoholism, psychiatric conditions, or manic-depressive conditions. Doxepin may have anti-inflammatory effects that may be relevant to dermatology conditions such as psoriasis. So how does Doxepin work? Doxepin hydrochloride is a type of medicine called a tricyclic antidepressant. It works by enhancing the activity of neurotransmitters serotonin and noradrenaline in the brain. Neurotransmitters are natural body chemicals that act as chemical messengers between the nerve cells. Serotonin and noradrenaline are neurotransmitters known to be involved in regulating emotion, mood, and behavior, amongst other things. In depressive illness, less serotonin and noradrenaline than normal is released from nerve cells in the brain. Doxepin works by stopping the serotonin and noradrenaline that has been released from being reabsorbed back into the nerve cells in the brain. This helps to prolong their effects, and over time this helps to lighten mood and relieve depression. Doxepin won't change your personality or make you feel instantly happy and relaxed. It works over time to correct the chemical changes in your brain that have made you become depressed and helps you get back to feeling like your old self. So how long does it take Doxepin to work? It can take between 2 to 4 weeks of taking Doxepin before it starts to work. So it's very important that you keep taking it. Even if it doesn't seem to be making much of a difference at first, you'll usually need to keep taking Doxepin every day for several months, and for at least 6 months after you feel better. You should keep taking it for as long as your doctor asks you to. How do you take Doxepin? You'll usually start on a low dose that is gradually increased, and Doxepin is often taken once a day at bedtime because it can make you sleepy. However, your doctor may sometimes ask you to take a smaller dose 2 to 3 times a day. Doxepin can be taken either with or without food, on a full or empty stomach. Doxepin is not addictive. However, do not suddenly stop taking Doxepin, because this can cause withdrawal symptoms such as feeling sick, headache, difficulty sleeping, irritability, and anxiety. Withdrawal symptoms are temporary and are not due to dependence on the medicine. They can usually be avoided by stopping Doxepin gradually, usually over a period of weeks or months, depending on your individual situation. Follow the instructions given to you by your GP when it's time to stop treatment. So what should you know about taking Doxepin? Doxepin may cause drowsiness, dizziness, problems concentrating, and blurred vision, and could you reduce your ability to drive or operate heavy machinery. Do not drive or operate machinery if you are affected. Doxepin can sometimes make you feel dizzy or unsteady when you get up from lying down or sitting, especially when you first start taking the medicine. To avoid this, try getting up slowly. If you do feel dizzy, sit or lie down until the symptoms pass. Doxepin can cause a dry mouth, which may increase the risk of tooth decay if you take Doxepin for long periods of time. It's important to practice good oral hygiene and visit your dentist regularly for checkups. Doxepin may make your skin more sensitive to sunlight than usual, so don't use sunbeds or sun lamps, and avoid exposing your skin to excessive amounts of strong sunlight until you know how it affects you. So can you drink alcohol with Doxepin? You should avoid drinking alcohol while taking Doxepin, because it will make you feel more likely to fall asleep, dizzy, or confused, or to have blurred vision. This effect is likely to be worse if you drink alcohol when you start treatment or after any dose increase. So what are the possible side effects of Doxepin? They'd be drowsiness, dry mouth, constipation, blurred vision, sweating or flushing, dizziness, particularly when getting up, fast heartbeat, sleep disturbance such as difficulty sleeping or nightmares, feeling confused or disorientated, feeling weak or tired, agitation, pins and needles sensation, headache, hair loss, skin rashes, increased sensitivity of the skin to sunlight, and weight gain. Can you take over-the-counter medicines with Doxepin? If you need to take a painkiller, it's fine to take paracetamol, aspirin, or ibuprofen with Doxepin, assuming these are appropriate for you. You shouldn't take cold and flu remedies that contain the decongestant pseudoephedrine or phenylephrine when you're taking Doxepin. If you need an antihistamine, it's best to avoid those that can make you sleepy, like Piriton, and go for the non-sedating type, such as Zyrtec. So what about prescribed medicines? You're more likely to feel sleepy on Doxepin if you also take other medicines that can cause drowsiness, such as the antipsychotic medicine haloperidol, barbiturates, benzodiazepines such as diazepam, sedating antihistamines such as promethazine, and sleeping tablets such as Zimovane, the opioid painkillers such as tramadol and fentanyl, and other tricyclic antidepressants such as amitriptyline. You may be more likely to feel dizzy or faint if you take Doxepin alongside medicines that lower blood pressure, including medicines used to treat high blood pressure and medicines that can lower blood pressure as a side effect. So, for example, benzodiazepines. If you're taking medicines that lower blood pressure, tell your doctor if you feel dizzy or faint after starting treatment with Doxepin, as your dose may need adjusting. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through my website, mytelehealth.info, or call into Lynch's Pharmacy, Douglas, Cork, or ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.